everybody calls me Mo. And at the moment, I work in the cannabis industry as a bartender for Verilife. But I also I'm trying to launch patient consulting on the side about CBD and cannabis use. Because even though here in Ohio, it is medical, there's a lot of patients that still don't have that patient education. You know, you go to a doctor, you see your doc, he writes out your prescription, and that's pretty much about it. You know, you get your medical card and then you go into the dispensaries. So we have a lot of patients that come in that have never had cannabis before or never used it before. So they ask us a lot of questions. But as some patients, actually some bartenders didn't even know that technically we are licensed cannabis consultants. We still aren't able to give out medical advice. So patients come to us and they're like, okay, well, what type of medicine am I supposed to be using? And we're technically supposed to say we can't give out medical advice, but this is what we'll provide for you. So I'm trying to give patients another outlet, so they can come and just talk to me instead of just talking to me as just a bartender, you know, to give them some type of education. And then it'll keep them from getting, I think it's called hypnosis or something like that, because there are some people that will get sick from cannabis.
Right.
But they should always start out with a low dose and then also ask them how they're going to consume their medicine.
Right. And I think, I know this one lady who was hospitalized, it had interacted with her medicine. So they told her not to ever use it again or she could die from it. And I was really surprised that I don't know if they over exaggerate. You know how medical people are. Because I've never heard of anybody, you know, dying from doing marijuana. But my name is Deborah. I'm a new psych nurse practitioner. I'm still working as a nurse though. But I wanted to get more educated on medical marijuana, the benefits and and the cons before I start to prescribe cards for patients. I've been interested in doing that once I started. But I did come across a couple scenarios during clinicals where some people were having bad anxiety. One senior citizen was hospitalized because she was using so much of it. And so it's a big concern for me to figure out whether it's something I should give or not give, especially with so many people having addictive problems. So that's something I need to become familiar with. And then the various strands. I know it's various strands that causes people to exhibit symptoms, bad symptoms more than others. Mm-hmm. And I think a lot of people are not aware. A lot of the prescribers aren't aware of that. And so that's why I want to get more educated. So if I do prescribe, I know exactly how to start them off at a small dose. And that's why I want to be involved in your program. And a lot of things I've seen too, a lot of providers don't really know how to prescribe it. Like they'll prescribe an amount, but they don't know how to dose it properly and people get too much. So that's something I need to become familiar with. And then the various strands. I know it's various strands that causes people to exhibit symptoms, bad symptoms more than others. Mm-hmm. And I think a lot of people are not aware. A lot of the prescribers aren't aware of that. And so that's why I want to get more educated. So if I do prescribe, I know exactly how to start them off at a small dose and titrate it if I think it needs to be titrated. Because I know this one lady, I mean, she had to be about, 75, 80 years old. And she was like not doing well with her, cravings for it. And I think she just had the access to get a lot. And she was doing it. She was using a lot of it.
A lot of patients come into, because I work at a dispensary, and I get a lot of the older patients to come in. You are right, a lot of the doctors really give them a very broad, it's hard to dose, honestly, because it's gonna work different for everybody. But the main thing I always tell most patients is that 10 milligrams of THC is normally an adult dosage. And I always ask, the very first question is, how experienced are they with cannabis? If they're not, then I always start with a very, very low amount of THC, maybe like 0.3. You can get a very high CBD THC regimen, and then slowly they can increase slowly.
As speaking on that, as far as the drug interactions, I think their delivery was bad. Say, oh, you're gonna die if you smoke cannabis. I think it's the interaction that it has on the actual medication itself. So if I have a patient who's on blood thinners, and they're on blood thinners because they have AFib, and they're smoking cannabis, and the cannabis is either going to make the Eliquis work too much or not work at all. So if you have AFib, you're going to need that Eliquis to do its job, or you increasing your risk for a stroke. So that's probably what the healthcare provider was trying to say, is you're going to, put yourself at risk of, dying by using the cannabis. But I think the delivery was whack, and that's what's a part of the problem. And that's why what I do is important, that I feel is important, because it helps bridge that gap between the healthcare community and the cannabis community, where they have a better therapeutic communication.
So some of the cannabis act as an inducer and an inhibitor.
You could do either or. And the thing is, for example, how they say don't drink grapefruit juice if you're taking medication. Right. It's the same scenario as that. I do have a couple of books that touches on different types of medications to avoid when you're using cannabis, and heart medications and seizure medications are like the top of the list.
You said seizure and heart medications? Okay.
And also your psych drugs. Like for me and my anxiety, I know if I do too much cannabis, it's going to trigger my anxiety. I'm going to sit here and I'm going to start overthinking every little thing. But if I use cannabis microdose, it doesn't have that same effect. So you have to know not just how much to use, but how to use it. If I do an edible, I'm going to mess up my anxiety. But if I do a tincture or if I smoke it, I have better control in dosing. So it avoids that, trigger to my anxiety.
Yeah, my son told me that the edibles are more potent than smoking it.
Yeah, because it converts in your liver to a chemical that's over 10 times stronger than the THC you actually ingested. And when you smoke it or you use tinctures, it doesn't bypass the liver, so it doesn't have that same effect.
For the most part, traditional medicine, like hospital settings, office clinics and stuff, they're not really like, and you're in Maryland too, right?
I am.
Okay, yeah. They're not really open to the idea, mostly because it's a Schedule I drug. But there are a lot of doctors and nurse practitioners here in Maryland that are prescribing. At this point, it's probably over 500 across the state that do it, and it's been working, like good results for their patients. Now, some nurse practitioners and doctors are, have a little bit more integrity than others, but I've been good ones that kind of stand behind the products, teach their patients. Really appreciate the conversation. I think that it was a very healthy conversation, and I loved it. And I want all of these conversations to come as wherever you are. If you're feeling stressed out, we can talk about it. If you have a new accomplishment, we can talk about it. If you have a question, we can talk about it.
If you find these conversations empowering, then you may want to join us in the Highline Tribe. We are a community of nurses and healers who are seeking alignment. Try the tribe today for a step towards a transformative journey towards wellness and knowledge. See you on the inside.